On July 2nd, in the New York Times, there was an article put out by Ronnie Karen Rabin titled "New Approach to Depression." And I read through it, and I thought it applied to this class on physiological psychology because the base assumption of physiological psychology is that for every action, thought, or feeling, there is a physiological event happening within the body. And the article, or the author of this article, is strictly trying to convey a new treatment that is being used, in this case, on people with severe depression that has not been responding to chemical or prescription drugs. And so they're using a treatment called TMS that uses magnetic pulses, very strong magnetic pulses, to create an electrical current on the surface of the brain, in this case in the mood regulatory section of the brain. And I just finished the chapter 2, which is on neurons, and the communication between neurons is pretty much seems to be how we define how we as people act and behave and feel about the world around us every minute of the day. And that this is another example of how we can take physiological opportunities or irregularities or abnormalities that are occurring inside the brain or the nervous system and treat those and help the patient live a more normal, quote-unquote normal life, or get rid of those symptoms that is bothering them or that's unwanted, in this case depression, severe depression. And so there's three different avenues that doctors seem to be able to look at. You have physical abnormalities in the brain or in the nervous system that can be treated. You have chemical imbalances or abnormalities, which has been treated for years with prescription drugs like Zoloft and Lexapro and Paxil and others that seem to have some positive impact on the symptoms that people are going through, mental defects or mental abnormalities. And now you have a treatment that addresses the electrical communication in the brain between the neurons and between sections of the brain. And in this case, using magnetic pulses, which some of the benefits of that is there's very little side effects, not invasive at all, and it seems to have some help for some patients. If I were to research this further, which I am, I would be looking at psychology publications, even medical publications, even Googling terms to try to find how other examples of this treating depression, and possibly how this can be used or is being looked at to treat other mental disorders or mental abnormalities that people are going through and suffering from. And if they can help reset that communication, which part of the chapter of neurons talks about how the communication between our neurons and our nervous system in general is created based on our genetic factors and environmental factors that we are exposed to. And once those lines of communication between neurons and pathways are set up, it seems that it's very hard to change those. It takes a lot of work and effort, and sometimes maybe it's impossible, possibly. But this treatment seems like it interrupts that communication, and the patient can possibly overlay or recreate a different self-talk, a different communication, or even maybe a different network from different neuron pathways, and create a different outlook on life, create a different feeling about their environment, and create different behaviors and actions and feelings they're having to their environment, which can be positive, hopefully.